name's Catherine Bullen and I'm a senior lecturer here. I teach on the MPharm undergraduate programme and also the pre-registration programme. So after our graduates have done 4 years at university during their MPharm degree, but also the OSPAP degree, which is for overseas pharmacists, they go out to work in practice for a year under a pharmacist supervisor. And at the end of that, they sit a registration assessment, and that's what they need to practice as a pharmacist in the UK. So that tests things like numeracy skills and also clinical understanding, how you would respond to different patient scenarios, and you must pass that to be able to register as a pharmacist and therefore practice in the UK. The pre-registration year is really important because it means graduates can contextualise what they learned at university and obviously what they've learned in an academic setting, but go out into the real world, see real patients, work with other healthcare professionals to be able to sort of get all their skills together so that when they do register as a pharmacist, they feel really comfortable in a working environment. When we designed the pre-registration course at Sunderland, we went out to our graduates and asked them what they wanted. And a lot of them found that when they'd done their 4 years at university and then left to go into their pre-registration year working in practice, they found it difficult to stay motivated with their learning. So we decided to design our programme for graduates to attend 1 day a month, and therefore they still come into the university for a day a month and get sort of tuition from ourselves and advice on how to sort of go away and reflect on what they've learned and how to sort of improve themselves ready for their end exam. So we found that actually rather than other courses that do sort of like block residential stays, we found actually the session a month was really helpful for our graduates to stay motivated with their learning. And the course is designed to include different sort of methods of learning. So we do lots of sort of case study based learning, which helps prepare you, but also lots of practice into numeracy and calculation skills and how we would work out doses for particular patients. We also run 3 mock exams at various points within the year, one at the start, one in session 6 and one at the very end. And that allows graduates to really see where they are on their kind of pathway to hopefully passing the exam in the summer before they register as a pharmacist. When I registered as a pharmacist, that was in 2010, the career options for a pharmacist tended to be you either worked in a sort of retail pharmacy like you would see on a high street, or some people went into hospital. But now the different variety of jobs is much bigger, and a lot of people end up doing sort of split jobs where they'll spend some time maybe in a community pharmacy like I do and the rest of their week in academia. However, some people might do, you know, split between hospital and community or hospital and academia, and even some of our graduates go into work in industry. One of the fastest growing areas for a pharmacist to work is a GP practice, where pharmacists can help to manage long-term conditions, provide help with patients on multiple medicines, and also provide clinical advice about different treatments. The world's your oyster with a pharmacy degree, really. There's a lot of different options you can do, whether you want to be, you know, at the kind of fine end of the knife dealing with patients every day, or if you want to do something more research or industry-based. There's sort of options for everyone.